This is about brain health and how it can be improved with a treatment called neurofeedback, which is a non-invasive treatment. So this non-invasive treatment can help create healthier brain patterns and help to alleviate things such as ADHD, anxiety, depression, PTSD, etc. This is a program that Gabe, our founder at G2I, has been a part of for a really long time now. He's seen a lot of benefits to this neurofeedback treatment with his own ADHD and anxiety and chronic illnesses that he deals with. And he's worked on this with Dr. Craig Tanio, who has now become our official partner at G2I for launching a neurofeedback pilot to be able to offer this treatment to anyone in our community or other developers that would like to try it out. So Dr. Tanio is a brain health expert, doctor and founder of Rezilir Health and an assistant professor of medicine at Hopkins. And I'll hand it over to you, Dr. Tanio, to give a little bit more about your background.
Okay, thanks so much, Michelle. And I'll certainly try to talk clearly and loudly enough, because I know that a couple of people were having some problems hearing, but really appreciate the opportunity to join this community and work with you all. My background is that I'm an internist and more of a generalist, as opposed to a neurologist or psychiatrist, but I have focused my practice and career now on brain health. And I see really three types of patients. About a third of the practice is people who are older, who have significant cognitive decline, and we've been leading a research study now into reversing cognitive decline for the first time. And the initial pilot was very promising, and now we're into the randomized control study. Third of the practice is really people who have very complex chronic conditions that are affecting the brain, which can include long COVID, chronic Lyme, mold toxicity, and other sort of chronic fatigue syndrome type of issues. And then the last third are those who are really interested in optimization and realizing that, if you have a healthy and high functioning brain, you have a high quality life. And I think everybody could be in different categories, but a lot of the principles are the same. We're going to certainly take enough time for questions here, and I'll try to do a brief sort of 10, 15-minute discussion and a presentation. We can talk at that point with questions. But we do believe that improving your brain health really offers the potential to improve your quality of life through improvement in cognitive and emotional performance, and do believe that the performance in those two dimensions is very analogous to physical fitness, where there's not necessarily has to be a disease or label to significantly improve performance. And performance can be objectively measured and subjectively enjoyed. We do think about, talking to a tech group, we think about the brain in terms of hardware and software, where we're thinking about the brain health down to the molecule level and how genes are transcribed, then up to how the wiring is going, and then finally about the software, how networks are kind of emergent processes and phenomena from the brain, and how that can be focused in particular areas and the anatomy of the brain. There's a whole variety of interventions that can address the different levels of software and hardware, but I don't need to go into all of the details, but just to know that there is a very broad toolkit that in today's world can affect things at multiple levels. And we do really think that this century is going to be the century of brain health and our ability to really continue to improve it better. What we do just in looking at brain cell health, don't look at any of the details, but rather just understand that when I look at these issues, we do think very much about lifestyle as being a foundation. and understanding how these things work in terms of individual stories, which is the thing on the left. And there are multiple systems that intersect with the brain to create performance. But as we talk about neurofeedback, we're really talking about how to upgrade the software. And we do think about your brain in terms of networks and nodes. There was a lot of work done in the Obama administration, sponsored by the NIH, multi-billion-dollar effort to really outline the connectivity of the brain. And a lot of that public information is now downloaded and part of the software that we use. Now, what neurofeedback is it's really biofeedback for the brain. And it's classic operant conditioning or just rewards, in that when you are using a neurofeedback device, you are getting signals that say that your brain is either moving in the right direction or it's moving away from the right direction, and you get feedback back so that you can adjust your brain function accordingly. Most of the improvement happens unconsciously, but it is something that, unlike a lot of things 10 or 20 years ago, that the level of feedback is very sophisticated and very precise. Certainly, neurofeedback can be done completely by itself, but it can fit into an overall performance improvement approach to your health. And it can help a whole variety of things, including brain performance around emotions and cognition. It can absolutely address anxiety, focus and concentration, depression, and improving memory. And just to give a sense, right now, sort of post-pandemic, more than 25% of the workforce is on some degree of medicines that are affecting brain function, whether that's stimulants like Vyvanse and Ritalin, or whether it's antidepressants or medicines to put you to sleep. And some people are taking all of the above. And there's no question that neurofeedback can be a way to train your brain to not need some of these medicines. How it tends to work in terms of the details, obviously there's a lot more we can go into, but we collect brainwave data with 19 channels, and we compare it to a normative database. So these are people who are in optimal mental health, emotional health, and cognitive health, age, sex adjusted. There are ways to basically translate the brain waves into maps or even 3D visualizations, and it shows whether there's higher or lower activity on different frequencies. The brain works at basically a frequency of down to 1 hertz, 1 cycle second per versus 30 cycles a second. And there's a way to basically translate that data into 3 dimensions so that we can actually look very specifically at networks or localization in the brain with just really a device that's easy to put on and gives information quite quickly. What happens in a neurofeedback session is that you get the cap put on. Over time, you learn how to do it by yourself. First time I did put a cap on, probably took me 10 or 15 minutes to do in the mirror, and there was gel all over the place. And after the 3rd or 4th time, it takes about like 2 minutes to do. So easy to put the cap on. You connect the cap to a device and a laptop. And then most of the sessions that we would do would be remote. So you would see your therapist, but they would likely be in a different place. But they would be monitoring what you would be doing in terms of neurofeedback and giving you instructions. The way that our devices now work, the vast majority of them have been around watching a video, where the video basically plays at a normal light and sound when you're moving towards the right end point, and it turns off when you're moving away from it. But we also now have the option to put some basic games on if people find the videos too distracting. And so all of that can be done remotely. Here's an example, a case example of one person who was a CEO of a major, Fortune 100 company, who had been on 2 decades of benzodiazepines for occasional panic attacks. And you could see that this red area here was localized in an area of the brain called the anterior cingulate, which is a known place for panic attacks. And he was a little bit skeptical of the utility of neurofeedback, but open to just action. And basically after 20 sessions, you could see how that area of focus has disappeared. And suffice it to say, this is from about 2 years ago. His benzodiazepine use went down by about 95%. So, maybe 2 or 3 every 6 months, as opposed to it was 2 or 3 a day, before. And so because his brain had basically trained itself to not go into these panic attacks. This is an example of a patient who had long COVID, which triggered a lot of anxiety, and it was really disabling, and she was not able to work. And then with treatment of long COVID and neurofeedback, was able to get back into the workforce and just back to normal, though there's still some of the, here after 20 sessions, not all of the COVID was completely gone. So there was still some residual things, more at the cell level than at the network level. We're wide open for people who are interested in improving performance and that feel like they're in good health and willing to train for a month. Almost anything that around cognitive and emotional we can usually improve, but very common would be anxiety and suboptimal focus, concentration, attention, or mood. We put the reasonably healthy because there's no question that neurofeedback can help. But if you have problems with your cellular health, but if you have better cellular health, it's going to work quicker, if you will. The pilot process, and Michelle and Gabe can talk to that more, would be really that there would be a sign up. We would do a 30 to 40 minute discussion to just make sure this would be a good option for you. We can absolutely at that point send the EEG to do it either remotely, or we're more than happy to do it in person if it's ever practical. You would get a brain report. You would then do training with the therapist. There is a potential option to move to the artificial intelligence way of training, which is definitely cheaper because it's not involving a therapist watching you. And we do get brain maps every 5 sessions, and we would finish when either the maps improved or the symptoms improved. And then, don't know, Gabe, if you want to share a few words on your experience.
Everybody, thanks, Dr. Tanio. That was fantastic. Yeah, the reason that we've partnered with Rezilir Health and Dr. Tanio is because we've seen burnout be way too prevalent in the tech space, specifically with software engineers. Michelle put a post up, I think about a year ago, and we had 600 respondents. More than 50% had experienced burnout in the last 12 months. So there's an element to battling against burnout, but also increasing, our performance as tech workers, software engineers, et cetera, et cetera. So there's a lot of discussion around burnout and mental health, but there's more problem-focused discussion than solution-focused discussion. So at G2I, it's our goal around developer health to bring solutions to the tech community and the developer community. So specifically for me, I'll share briefly, and then we'll move to a Q&A. I was able to, in about 20 sessions, see a massive amount of improvement. These are, I think this is beta or high beta. Craig, correct me if I'm wrong, the 13 to 16 hertz.
Yep. Mm-hmm. Mm-hmm.
So I was experiencing a lot of anxiety, just overall anxiety, and also difficulty with concentration. So this was, before I started, 5 sessions in, you can see the red disappearing. I want to see as much white as possible. That's getting me to less overactivity in this high beta range. And then 10 sessions later, I'm seeing no red. So I was able to experience a massive shift in my ability to function as a founder, with lots of different challenges going on, lots of different decisions to be made. And, my goal is to make high quality decisions and care for people well. Those are 2 things I do as a founder every day. And it's hard to do that when you're constantly dealing with anxiety and you can't concentrate and you can't dig into to complex problems. So we've done a lot of work, as a community, in the browser, in these different tech stacks, optimizing, even with AI, with Copilot, et cetera, et cetera. But we've largely forgotten as a community about how to optimize, our brains, which are making these decisions and ultimately responsible for writing the code and solving the problems. So we want to bring this to you. You can find more information on neurofeedback.dev. If you move forward with the signing up for the pilot, essentially you're just having a 10-minute call, with Dr. Tanio. There's no pressure to sign up. This is, we want people who have the means to do this and have the time and want to do it. So you'll just be chatting with Dr. Tanio, and then you can decide if you want to proceed with the initial QEEG testing. So we'll move on to our Q&A portion, and thank you, Dr. Tanio and Michelle, for setting this up.
Awesome. Thank you so much, Dr. Tanio. Thank you so much, Gabe, for sharing your experience. There's so many questions to ask. We did share the link, neurofeedback.dev, which has a lot of answers and an extended video presentation from Dr. Tanio and Gabe discussing their experience and their knowledge in this area, along with answers to a lot of frequently asked questions. So I'm going to start with these questions towards the top, and hopefully we'll be able to answer all of them. But the first question is for Dr. Tanio. How do you adjust the brain function specifically? What's the process involved to adjust it? Yes, go ahead. Sorry.
Yeah, it's a great question. So again, to some of the specifics, but I think I want to do 1 or 2 setups. So if we think about, if you have a problem, let's say you twist your knee playing volleyball on the weekend and you come in and say, well, I got to fix my knee. There's not much baggage associated with that. It's like, oh, well, you got to go fix it. And I think here on the same thing on the brain, I think we do sometimes carry a lot of baggage with, problems that we have with brain performance. And I think we, just shouldn't. And then I think number 2 is that there are a pretty broad set of things to both figure out what's going on and to address it. And, we have in our practice, we just have a wide toolkit. So we're not kind of coming to you with saying, hey, I got this great hammer and the hammer's good for everything. It's like, no, the hammer is good for some things, but not for everything. And so what we'll do is it's just understand the brain. The complete toolkit might be understanding subjective things. So surveys, questions, how things are feeling, objective measures of performance. The QEEG actually helps us understand how the electrical networks are working. And then finally, you can get a look at anatomy if need be with an MRI. But we have this pilot sort of targeted to really just do the performance, the surveys, and the EEG, and no MRI. But at any point, if there's ever something that this doesn't look like it's the right match, I'm pretty comfortable in kind of going from all extremes, and at least I can help people kind of understand what's right for them. So.
Awesome, thank you. This is one of my favorite questions. I love, how does neurofeedback compare to meditation?
So I think that neurofeedback is meditation with feedback, if you will. And so there's one of the challenges with meditation has been historically there hasn't been as much feedback. Now that's starting to change. So you have like the Muse device that will kind of give you some scoring and that kind of stuff. And the Muse device is basically meditation with a simple neurofeedback one channel. But what we're usually looking to do is we encourage people to not necessarily go into a specific meditative technique or approach, because it all depends on what the and what's needed in and on their brain scans. So meditation will absolutely increase the alpha waves, for example, and decrease the some of the dysregulated beta waves. But that may not be what the person's issues are. And so I think what neurofeedback does is it gets quite precise as to giving your brain feedback at what direction it goes. The other advantage of neurofeedback is there's no external device that's giving your brain signals. Anything that's happening with therapy is that your brain is doing it to itself. There are other things called like electrical stim and lasers and other things that are external stimuli, but neurofeedback is the brain just treating itself. And so it's therefore the track record of safety is stellar. There really has been very few severe or persistent side effects from neurofeedback because the brain is treating itself.
And let me just jump in briefly with my experience, and that is, I did meditation via DNRS, dynamic neural retraining system, for almost 2 years, and it was fantastic and extremely powerful. But neurofeedback compared to even, guided meditation is almost like industrial strength. It's, meditation on steroids, and it's been able to be targeted, towards, if I say, hey, I'm having trouble concentrating or I'm having trouble falling asleep, then the protocols can be switched based on what I'm struggling with at that time, and I wasn't able to do that obviously with meditation.
Yeah, it's a Swiss Army knife with a flashlight.
Yep. Yeah, for sure.
Okay, thanks so much, guys. This question is from Kelvin. He said, how do I improve my memory? I barely remember past events compared to my peers who remember past events 10 times better than myself.
Yeah. So it's a great question, and I think what's first important is to try to get at least some objectivity about where you are. So, for example, we could offer a computerized test called CNS Vitals, which is about a 30-minute test. It's been validated by Medicare and other medical groups, and it gives a good sense of how the brain is doing in terms of verbal memory, visual memory, focus, concentration, processing speed. And we see increasingly, like I said, in the second category, I have a number of my patients who are, people who had to drop out of Stanford, Harvard, Michigan, we got a whole sort of set of schools where because they had some external illness that affected their brain from really working at a high level, and then they would go to the neurologist and say, well, you score fine on the IQ test. You don't have anything to worry about. And they were like, no, wait, I really lost 30% of my capacity and I'm used to functioning here and now I'm here. And the good news is we're able to really get that back. But I think if there's a memory thing, it's just first trying to get some objective data to really see where you are. And then memory can absolutely be improved, but it all depends on the bigger situation. Sometimes people need more micronutrients. Sometimes people need, more circulation. Sometimes people, can really benefit from, memory, gains and those type of things. But it is definitely not one size fits all.
Thank you. Thank you. We have a couple more minutes. So this next question, can you talk more about the costs? Is there any financial assistance or payment plans available for participants who might find the cost challenging? And I think this question is also or the answer to this question can also be enhanced by kind of looking at the past offerings of neurofeedback and what things used to cost and how you would go through it versus what is being offered today.
Yeah, so I think on the in my practice, when it comes to money, I always let my office manager handle that because I may make a mistake or two, and so I'm gonna not get into dollars sort of here, except to say that Michelle has all the the pricing on here. But what we have tried to do is make it as cost effective as possible, and certainly the initial assessment I think is priced very comparably to anything that would be out there on the market. And what we're doing on the neurofeedback is we're doing very high quality neurofeedback that has a human component and is really adjusted every 4 or 5 times. There's a lot of potential options on the market where people are trying to take cost out of the system by either A, moving to artificial intelligence, or B, trying to have more of a one size fits all protocol. And just call me in the conservative group. I've just seen so many times where you might have 3 people with the exact same symptoms, but then the underlying maps might be quite different, and therefore the answers are different, if you will. And I kind of feel where we are in this stage. I'm a complete believer. Before I got brought back into this, I was a partner at McKinsey and Company, and I'm a total believer in going down the cost curve and getting the cost out of the system. But I don't think that we're quite at that yet in terms of just having dirt cheap offerings yet. But what can happen is if you get a good assessment, for example, and let's say, you do 10 neurofeedback sessions, but it's too expensive to do more, but it's not complicated. You might be done in 10, or it may be that a 1 or 2 channel system is more than sufficient, and then that cost is 80% cheaper than the human one. So, we're, like I said, we're not beholden to just the hammer here, but it is trying to kind of, initiate a dialogue with the community around the operating system, which is, let's actually try to see if we can improve our performance by kind of addressing some of these issues that are not, there's not always sort of easy conversations around that. And I think if we can kind of open that up and have a little bit of the more challenging conversations, I think there's a lot of improvement and juice in life that can be dramatically improved by taking that action.
Awesome, thank you so much. So we're at time for this session. So I wanted to just say another reminder, neurofeedback.dev has a lot of information on the program and about neurofeedback. And I want to thank everyone for joining us today. Thank you, Dr. Tanio. Thank you, Gabe, for sharing your knowledge and experience. And thank you everyone who joined and asked questions. If you have any other questions or would like more information, there's a form at neurofeedback.dev to sign up to get connected with me. And feel free to send us any questions. If you want to schedule a 10-minute consultation with Dr. Tanio in his office, we can set that up as well. But in any case, I hope that this was really informative and enlightening. And thank you, Dr. Tanio and Gabe, for joining.
All right. Thanks, everybody. Really nice to talk today. Appreciate it.
Thank you, Dr. Tanio. Thank you, everyone, for joining.
Take care.
Bye.